Hey, what's up, guys? Welcome to another episode of Three Wise Men. And today's a special episode because I get to mess with Brian today. And I get to shove a, N as in Nancy, P as in Paul, and A as in Adam up his nose. But first, I'm Andy. This is Turbo. Of course, we know Brian already. And our special guest, Billy from My Medic.
They call me Turbo because I'm a speed demon.
I'm Brian Goldstein. I went from special ed student to 8-figure CEO.
I'm Andy Kelly Fresh. I'm a double agent, and together we are the Three Wise Men.
What is an NPA?
So, NPA, Nasal Pharyngeal Airway.
I'm sorry?
Nasal Pharyngeal Airway. How about nose hose?
There we go. See?
Nose trumpet. So you don't need to pronounce it, you just have to know how to use it, and that's the easy part. It's easier to put in than to pronounce it, I can tell you that right now.
Hey. Sorry, buddy.
We got a little surprise for you a little bit later. Before we get into the actual NPA itself, because we're on the A on the march as we're going down these episodes, right? So A is for airway. If your patient is losing their airway due to a traumatic situation or they're losing consciousness, you need to provide an airway for them. And this isn't a choking thing or anything like that. This is basically their tongue is relaxing and starting to rest on the back of their throat, closing off that airway due to losing consciousness, that kind of thing. So choking's totally different. We're just basically creating a little space, a little airway between that tongue and the back of the throat so they can breathe for themselves.
So the question's probably going to come up, and I know it sounds funky, but if they just got pulled out of the water and they're unconscious, obviously this is not the thing to use.
Correct. So when you're thinking about that kind of drowning situation, you're thinking more BLS, kind of Red Cross, like, hey, I need to breathe for them, maybe chest compressions, that kind of thing. This is different. This is kind of if someone's losing consciousness, generally due to trauma, their tongue's relaxing and the back of their airway's getting cut off. So a big indicator of that would be if you kind of hear like a snoring from that person. You're like, oh, I know what's going on. And it's the same thing as snoring at night, because all your muscles are relaxed and that airway starts to close off and you snore. So that's a big indicator, like, oh man, I'm gonna put an NPA in this person.
Do we have an NPA just for adults, or can you put it on babies? Or
Absolutely. So there are several different sizes of an NPA. You've got adult sizes, you've got pediatrics and like kid sizes. I'll show you how to measure it here in a minute. And then I'll go through a couple little tricks like, hey, what if it's too long, stuff like that.
And again, like anything, like a tourniquet, like we talked about earlier, these things aren't made for comfort. They're made to solve a problem at that point.
100%. And when I do my training on this, so many people naturally are, real ginger and kind of timid. And I'm like, go, get it in there, make it happen. Because, it's not the most comfortable thing, like a tourniquet or whatever, but it's got to be done, like you said, and it's, oh, I don't know, man, get it in there and make it happen. So get this person an airway.
Got it. So this is going to make Brian really happy then.
Funny.
If you would, Turbo, come over here. I want to show you just a couple of manual moves to help open that airway and get the tongue off the back of the throat. The first one is called the jaw thrust, and it's just that. You'll take your thumbs. If you guys want to feel behind your jaw there's that angle, right?
And you're just pushing up.
Yeah, so all you're doing is you're pushing that forward. And that's physically taking that tongue, because you're moving that whole lower section forward, is taking the tongue off the back of the throat. That's one way. Go ahead and lay down on your back for me real quick. Again, this is just one way to open that airway when you're trying to get the tongue off the back of the throat. So one hand's going to go up top here on the forehead. The other, I kind of like to pinch the chin like this. What you don't want to do is apply any pressure to the neck, but downward pressure like this, and you're basically kind of opening their jaw for them and kind of pulling that tongue out and away from the back of the throat. So right here, this will allow okay, I can inspect to see if there's anything in here, but the main reason we're doing this is to create that space between the throat and the tongue. So those two are great. They'll work to open the airway, but the issue with that is, okay, now I'm doing the head tilt chin lift, which is what we just did here. I can't walk away, because as soon as I do, that airway is going to start closing again. That's where we start talking about the NPA. Let's do an intervention to where I could put it in and walk away from and know that I have created an airway for that patient. So if you'll lay on your back for me, what I want to do is kind of talk you guys through the step-by-step process on how to insert an NPA. Now, we're not going to insert it, but we're going to go through the motions I'm gonna tell you a couple things, and then we'll get to maybe a live situation in a little bit. We've identified that, hey, this person actually needs an airway, needs a little help. What we're gonna do is take our NPA, and of course we're gloved up, and all this goes without saying, but so we've got two main things here: the NPA itself, and then you have to have some kind of lube, right? Like this is gonna make your life easier. It's gonna be more comfortable for the patient. So lube and oh, will you flip over? Some main points here. You've got the top, which is the flange. You can see this little bevel right here, that slant, and then the main body. So that slant is gonna go on the patient's right side. So that slant's gonna go against the septum, right? So it's created to go nice and flush against the inside of the nose there. A way to measure this is the flange goes against the nose, which is this part, and that bevel goes against the ear. If that matches up, that should fit that patient pretty well. Because when you put this in, you can imagine the patient's natural anatomy. Sure. The airway goes down like this. So when you said, I'm gonna shove this up his nose, it's actually you're gonna shove it down his nose. So keep that in mind, right? So it just follows the natural anatomy and creates that space. So I'm all gloved up, I'm ready to put this thing in. I take my packet of surgical lube or whatever kind of lube you have, and I like to keep a dry spot where my two fingers are, because that way it allows me to manipulate it pretty good. And this stuff's super slick and slippery, so I can do that. And then the rest of this will get lubed up. What you don't want to do is get any up here, because then that's going to occlude that freaking hole that you're trying to, breathe out of. So lube the whole thing up, right? And then give your patient a little pig nose, right? And then insert, and then push it all the way down. And at the end, like this little thing's gonna be sticking out like this. This will be inside, creating that space for his airway.
Do we need a test subject? Is that what you're getting at?
Yeah.
Well,
I heard
he went already, and
you were a demo
I was a
guy.
demo.
I guess.
I think you're up, Ryan.
No, you are home. Get on the table. Come on, dude.
You kill me, I'll shoot you.
There we go.
Okay.
Can't kill me if you're dead already.
So I'm gonna give you a pair of gloves, because it can get messy. And again, when you're dealing with patients, especially with this kind of stuff, man, you're talking about all kinds of bodily fluids. So, all right, so here's your equipment. I'll help you every step of the way, but I want you to talk me through it. And if you jack anything up, I'll stop you and correct it.
Got it. Is this fairly idiot-proof?
Yeah, that's what's so cool about a lot of these things we're going over. Yeah, they might seem kind of invasive or whatever, but they're actually super easy to do. Sure. And they're life-saving skills. So
What happens if you sneeze wearing this thing?
it'll go shooting out. So remember, keep that two-finger area pretty dry. It's gonna make your life a little bit easier.
You look like you've done this before.
You know what? I don't know what I'm doing, to be honest. All right, Brian. You ready?
Nope.
All right.
I'm gonna pinch his nose back, little pig nose, and then.
If you just breathe normal, Brian, and just if you want to swallow, that can help too. Just keep swallowing.
Good at that.
That's what she said.
Ready?
Yep, make it happen. Yes,
Breathe, Brian.
just like
Breathe.
that.
There you go.
Breathe. How does that feel?
You good?
Doesn't feel great. Doesn't feel horrible.
Winning fast, right?
But actually, can you tell that difference in your breathing?
I can actually breathe easier.
Yeah. So we'll get this out in a minute. I know it's not super comfortable, but let's talk about something real quick. Let's say he's kind of like starts to gag a little bit. It's triggering his gag reflex. Super easy. All you have to do is withdraw a little bit, like pulling that out a half an inch. We'll fix that.
Got it.
So, and this is a stopgap before he gets like a major airway in. You just bought this dude time till the paramedics show up or you get him to the hospital. So taking it out is just a nice little curve of the wrist and just get it out.
Brian, you want it fast?
No.
You sure you don't want it fast?
Yeah.
What was that
Nice.
looking at, dude?
Dude, good job, man. When you're going to work and you're like, I've got an NPA in my kit, how do you feel about putting one in your partner, putting one in your teammates?
I think the application of me doing it to a partner or to a civilian or a victim is easy. He's calm. None of the people that I deal with and or that you've dealt with are calm. They're hysterical. They're panicking. They're going into shock, which is the whole point why this is going in the first place, right?
Right. So there's an issue with their airway. But keep in mind, generally speaking, because they're losing their airway, they're losing consciousness. If a person's alert and oriented, they probably don't have a huge issue with their airway, and B, they're not going to tolerate it. They literally, like I've seen it plenty of times, to where they're just not going to tolerate it. So this is for the semi-conscious and certainly unconscious patient.
Got it.
That's it. That's all there is to it.
Sweet.
One thing though, so I probably should have mentioned this beforehand. We're going to do some wound closure stuff, right? And we're going to start looking at like staples. I guess to be fair, you can probably staple Andy?
Yeah.
I mean, is that
I
fair?
love how you leave that to the end,
All right,
huh?
cool. Let's do that.
Well, guys, yeah, I don't even want to end this episode because I know what's going to happen on the next one. So I guess like, subscribe, and follow. I probably won't be here on the next episode. I'll probably be sick, but tune in anyways to see if I show up and I actually get stapled. It's not going to happen. But till next time, guys, and take care.